We'll be watching all of those new developing stories throughout the new year, but unfortunately, another story we're all too familiar with is stealing the spotlight again. COVID-19 cases are surging around the U.S. as well as here in New Mexico. According to the latest briefing from the state health department, there is some good news. Hospitalizations from the virus have fallen since the peak at more than 700 in the middle of last month. So let's bring in our line opinion panelists. Welcome to UNM Law Professor Serge Martinez. Always good to have Serge. Girl Scouts of New Mexico CEO Rebecca Latham, one of our newer panelists, is with us. Always good to have Rebecca. And editorial page editor at the Santa Fe New Mexican, Inez Russell Gomez, joins us as well. Thank you all. Now, health experts say the new variant driving these cases is milder than any strain of the virus to this point. But guys, how do we balance that positive with the reality some healthcare workers, particularly those in the ICU, are still facing each day? And Rebecca, let me throw that to you.
Honestly, Gene, I don't have an answer for it. Yeah. I don't think anybody has an answer for it, because
if we
didn't, then we'd be doing it. It really is. It's such a tragic situation because, personally for me, I'm all the vaccine, right? Mm-hmm. Like I've got all the vaccines and my children are vaccinated, and it's something that we believe in strongly. And yet I know very educated people who opt to get all the vaccines, all the other ones, and not this one. And right. And it's like, you really have to think about that. It's fear that's driving that. Mm-hmm. But that fear puts us in such a bad position with our very limited resources. New Mexico was in a bad position with healthcare workers before the global pandemic. Yeah. So I don't know where success is with this or what we're going to do about it, because I feel like the people who have not seen the light yet to be vaccinated, mm-hmm. I don't know what hope we have for them.
Mm-hmm. Inez, the data released by the state health department on Wednesday shows Omicron spreads at a rate 3 times higher than the Delta variant, which had been, the most transmissible as we knew. But the good news is, unlike Delta, early data shows hospitalizations are likely to fall as Omicron spreads because it's more mild. At what point do we begin to reframe what it means to contract the virus? Is it too early to say at this point?
I think it is too early to say, because mm-hmm. I think there's an understanding that COVID is going to be something that we live with, which means, of course, that we can't have permanent lockdowns. We can't be closing restaurants or schools and those kinds of things. But at the same time, because it mutates and changes, mm-hmm. there is great interest in stopping the spread as much as we can, because Delta didn't spread that quickly, but it was fairly deadly.
Right.
Omicron spreads quickly. It's not that deadly. What I'm afraid of is a variant that spreads quickly and kills. Mm-hmm. And I would like to see that not happen. So I think we have to keep persuading, not shaming, but persuading people to get vaccinated, beg them if we have to, maybe nurses who work in the ICU can make more pleas or something, mm-hmm. because if we get vaccinated, we're okay. We've shown that over and over again. 80% of the hospitalizations or so are people who are unvaccinated. The deaths are people who are unvaccinated. Mm-hmm. We've just got to stick to the facts and persuade our neighbors, even if they won't see the light, just keep it up.
Mm-hmm. Serge, several employers and organizations now requiring boosters as a condition of employment. It's kind of interesting. I want to mention something about what's happening in Europe right after this as well. But should this be adopted on a wider scale?
I say absolutely, right? My employer has required it.
Okay.
I certainly didn't have a problem with it, but I think as Inez was saying, right? Carrots don't work, sticks, then you bring in the stick, I guess.
But is it that easy? I mean, we've got hospitals now firing huge amounts of people who refuse. I mean, these are healthcare workers, not construction people. These are healthcare workers who are now out of a job because they refuse to get either vaccinated or boosted. They should know more than anybody of the efficacy of doing this. So how do we convince other people that they need to do this?
Yeah, Gene, I'm completely unsympathetic here. I think,
nice.
If it's a condition of your employment to do this, and we, the society, say this is a public good and we want to incentivize people to participate in that public good, mm-hmm. then you can make a choice, but you can't then complain about the consequences of that choice. Mm-hmm. And I think as Inez was saying, how do you get through to people? At some point, you just can't, which is fine. But then we need to just say, this person has made a conscious choice to be on the receiving end of the impact and stuff and feel the repercussions of that choice.
Mm-hmm.
And, the people who are doing that are keeping my kids from being able to, do some of the things they're trying to do, that are sending people to the hospital, that are causing it so folks who have other conditions can't get into the hospital because they're full of people with COVID. I'm just completely unsympathetic to folks who choose to perpetuate that.
I hear you. Rebecca, it's interesting. The health department data shows only 17% of kids age 5 to 11 have gotten both of their primary vaccinations. Should we be is that the end of it? We should be concentrating on as kids and their parents.
I think it's parents in general, but going back to what Inez and Serge said, it's really kind of understanding the root reason of why people are not choosing to get vaccinated. And for me, I don't think it's that people don't believe in science. I think it's that people are, again, their decision is rooted in fear. Like, this was rushed, and it doesn't mean, my family, again, we have chosen to be vaccinated, boosted. It doesn't mean that that people don't believe in science. It's that they're afraid that this science wasn't thoroughly vetted.
Right.
And, in neuroscience, we know that the brain will connect dots that aren't necessarily there. And so we have this narrative being driven by fear, again, that's making people think that if they vaccinate their children, that something horrible is going to happen down the line, or that they just don't know. So how do we persuade them? We've got to get more back into the root cause of what they believe, or what it is why aren't they vaccinating their children? As a parent of kids in elementary and middle school, we're getting notifications 2 to 3 times a week that there's been another COVID positive case, and it's coming. And again, these are still primarily Delta. So once Omicron hits, it's we can't get rid of it.
Mm-hmm.
So I think our best bet is to tackle the psychology behind what's driving these decisions to not vaccinate your children or not vaccinate yourself, and try and take a stab at it that way.
Interesting, Inez, when you think about how one does this to either incentivize folks to do something and take a step forward, I can't help but note what's been going on in Europe. We've got a big tennis star that was just booted out of Australia because he's unvaccinated. We've got the president of France saying, what we're going to do? We're going to turn the screws on the unvaccinated and make it so difficult for them they will have no choice but to get vaccinated because they're not going to be allowed into anything. Italy just laid down the law that starting, I think, in February, it's going to have to be required to get vaccinated. Is that the best way to go? Is just drop the hammer on people here and just say you're going to lose out if you cannot show a vaccination card?
I don't know if it's the best way, but it might be a necessary way. I'm with Serge in that I don't have a whole lot of sympathy in the sense that if you don't believe the science of vaccinations, it makes no sense to me that you then go to the hospital to believe the science of those doctors and nurses working overtime to save your life.
Thank you.
None of this makes any sense. I think in a free country, you can't, track people down and vaccinate them like you would a horse or a cow,
right,
against their will. But you can say, we have to protect ourselves and we're going to isolate you until you change your mind. I still prefer almost the one-on-one, just go door to door and talk to people and hear their fears, because I think that may be the way to get through the people who aren't so politicized, but maybe just are afraid or scared, or even people who don't trust medicine because their group was experimented on. There's different reasons for not getting vaccinated, and we've got to concentrate on protecting as many people as possible so we don't collapse our healthcare system.
Serge, I got to go back to schools here for a little bit, just to finish up here, because it's important for our viewers. How are they supposed to, I heard Rebecca's point loud and clear here, but how are schools supposed to react to the mixed bag of data coming from Omicron? Are the risks too great to loosen protocols at this point, or are we on the right track? What's your sense of it?
Well, I have 2 kids who are in APS, and we, watch this unfolding in real time as well, like Rebecca was saying. I think, what we do know is, in terms of the risk to kids of of the virus, it's, statistically pretty low. The risk to kids of not being in school and the negative, consequences of that, we know that those are pretty high. So I think erring on the side of doing everything we can to keep schools open, available, so kids can come and be educated and, and hang out with their peers and all the things that go with that. We here at the law school, we've seen tremendous mental health as well as physical well-being, challenges throughout the pandemic. We know the consequences that, of not being around, not being here at the law school, but all the way, certainly way down to the grade school level. And so it is complicated. There's no doubt about it. There's no single, this is the right answer. But I do think erring on the side of trying to do everything possible so the kids can be at school is the right answer.
Rebecca, we'll finish with you again. You're a parent. What do you want to say to parents out there when it comes to their kids in school and everything else? We got to get this idea that we're all connected across,
I think, I would just, I love what Inez said, going back to the one-on-one approach and really trying to talk to it, and I am 1000% behind Serge. Like, we've got to keep the schools open to the best we can. I'm so glad that the public education department and our largest system, APS, that they're both, putting out plans to how do we keep kids in school and how do we minimize having to close. I know that I am just continuing to take that approach, the one-on-one approach. And other than that, I don't know what else we can do. It's happening. And, I think we all just need to buckle up and pray that our kids remain safe and healthy in mental health and well-being means being in the classroom.
Good points there. Thank you guys for all of that. If you haven't gotten a vaccine or a booster yet, you can find out where to get one on the State Health Department's website. We'll be back with The Line in just a moment with their thoughts on what's been a record-setting year for crime in our state's largest city.